Well, hi, everyone. I want to thank you for joining today. My name is Corey Hood, and I'm part of the DiabetesWise team. Also from the team and also from Stanford University are Sierra Nelms and Julia Viana, and you'll hear from them as we move along today. But this series of town halls is being put on by the DiabetesWise team. And one of the reasons that we created DiabetesWise was really to offer people with diabetes a free and unbranded resource for understanding what diabetes devices and technologies might best fit their life. We certainly have a bias toward using devices, but we think that we also think that people with diabetes across the board should have access to devices and should have access to the devices that they want. So one of the things that we've done with DiabetesWise is we've tried to do this webinar or town hall series because as we worked with people with diabetes, we've heard from them during this COVID era that there are some issues with getting technology, getting devices, navigating telehealth, and some other areas. And so we wanted to have this as a resource for people. And so in addition to what you'll see here live today, you can also visit diabeteswise.org and click on the COVID tab, and then you'll see other webinars that we've done that you can follow up on. All of this work with DiabetesWise has been made available by the Helmsley Charitable Trust. So we're really grateful for their support. A couple of logistics for today's session with the panelists for the panel of people with diabetes. If you have some questions, please drop those in the chat. We'll make sure that we get to those as we move along today. You'll also notice a few links that are provided in the chat. We appreciate any kind of feedback you have on this series and any other topics that you want to bring up on there. So I'm excited about our panel today because we have three amazing people with diabetes, and I want to dive right in and get to hear from them and their perspectives. Before I do that, and they're probably sitting there going, when are you going to start talking to us? But I do want to throw a poll question up because we want to also hear about who's in the audience, who's listening. So maybe we have that first poll question, which is, what's your connection to diabetes? And so you can see there, you can have responses of type 1 diabetes, type 2, you care for somebody with diabetes, or you're a caregiver or partner of someone with diabetes, or you're a healthcare provider. Also, you can click other if you'd like, but we're really interested to know who's here and who we're engaging with today. So maybe that's enough time. Julia, if you think, can you share those results? Great. So hopefully everybody can see, but we have a little, almost half of the people in attendance have type 1 diabetes, several individuals with type 2, there's at least one caregiver partner there, and then we have several healthcare providers. So thank you everyone for joining today. So I want to dive in with the three panelists we have are Sharice Shockley, Tiana Cooks, and Kyle Rose. Now maybe I'll ask Sharice first. If, I'd love to hear your introduction to yourself by telling us your diabetes diagnosis story or your experience with diabetes from the very beginning. So I'm going to turn it over to you and ask if you could tell us a little bit about your diabetes diagnosis story.
Hi, everyone. First of all, thank you so much for having me. I feel honored to be here. So my diagnosis story is a little bit different. I was newly married. My husband was in Iraq. I was 23 years old, and I had a yeast infection when my husband was home on emergency leave that I couldn't get rid of. So after he went back to Iraq, I went to the Troop Medical Center and told the nurse practitioner, I'm like, I don't know what's going on. I have this yeast infection that I can't get rid of. And so she was like, have you lost weight? And I was like, yeah, I lost 10 pounds. I look good. She was like, do you think you could be pregnant? I was like, no way. Husband's in Iraq. She was like, okay. She was like, any family history of diabetes? I was like, nope, no family history. She's like, let me check your blood sugar. And I was like, okay. She checked it, and it was 350. I had just had a Smoothie King smoothie before coming to the appointment. And so she was like, well, you know, I'm not sure what you have. She said, I know it's diabetes because your blood sugar's high, but you're 23 years old, so you don't fit the classic juvenile diabetes, and you're too fit, right? That stereotype to have type 2 diabetes. She was like, so let me run some more tests. And she ran some more tests. First, she sent me home with a beater, and she just told me to check my blood sugar. And then when she received my test results, she was like, I have never seen anything like this before. You have a working pancreas like a type 2, but you have antibodies like a type 1. I'm not going to try to diagnose you. I've never seen this before, so I'm going to send you to an endocrinologist. So she recommended me, sent me a referral to go to one of the endocrinologists in the Kansas City area, who was actually the only one performing pancreas transplants. So when I walked in his office, he said, hey, I already think I know what you have, but I'm going to take about 15 vials of blood, and we're going to determine what it is. And I was like, what do you think it is? He was like, have you ever heard of type 1.5? And I was like, no. He was like, well, I think that's what you have. So to make a long story short, I ended up, and he was right. He was type 1. I had type 1.5. I wasn't mixed diagnosed, which was a blessing because you hear so many stories about people being misdiagnosed. And I would say that a lot of people don't talk about yeast infections. So for me, that those two things hits close to home when I talk about diagnosis.
Yeah, well, thanks, Sharice. Thanks for sharing that. And I'm pretty sure that you never want to be on the other side of a healthcare professional saying, I've never seen this. You're so unusual. So I'm glad that you were so resilient and continued to advocate for yourself in that situation.
Thank you. I actually had it happen twice, but I'll talk about that later.
Okay. So maybe I'll go to Tiana Cooks, and would love to hear from you as well about your diagnosis story and what was memorable about it. What was, what do you want to share with us from that side?
Yeah, first off, thanks for having me as well. I'm extremely thankful and grateful to be here talking with you all today. So I was actually diagnosed when I was 17 years old, and I was a senior in high school. So it was March of 2014, and I graduated in May of 2014. So it was a lot of change going on in my life at that time. I remember track season had just started. I was running track ever since middle school. So everyone at my school, the school nurse, everyone was like, you're losing all this weight, and it's because you just started track season, duh. So I'm like, yeah, they're right. I've been running a lot these past few weeks. That's why I'm like, minus 20 pounds almost. I lost a lot of weight, and I kept using the bathroom at school. The teachers were wondering why I was going so often. And I just remember one morning waking up and everything was blurry. Like I could not see anything. And I went to my handy dandy iPhone and typed in my symptoms. And the first thing that popped up was type 1 diabetes. So I went to my mom and I showed her my phone. I was like, Mom, I think I have diabetes. I think I have diabetes. She's like, stop saying that. Because she's like one of those, you speak it into existence type of people. And so I was like, all right. Later that day, she takes me to urgent care because I had strep throat for about a week and I wasn't getting better. And right before the doctor left, I remember so vividly, like not wanting to say anything because my mom told me not to, but I still did. I was like, hey, just so you know, like I've been wetting my bed. I've lost a ton of weight. My vision's been blurry. I don't know what's going on. She's like, okay, we'll check your blood sugar. We'll send you home. She just ran some tests. They sent me home, and then 3 hours later, I was on my way to Yogurt. She calls my mom. She's like, Tiana needs to go to the hospital right now. Her blood sugar is at like 575. And at that moment, I knew it was diabetes because they told me, like I had already looked up my symptoms. But for me, I didn't really know the extent to which diabetes was going to impact and kind of change my life. So I'm still learning every day. It's been a journey, but I'm here, so I'm very thankful for that.
Well, thank you for sharing your story. And so it sounds like you've been diagnosed for about 6 years. Is that right? A little over 6 years. Okay. Well,
Cheers.
great. Thanks so much for sharing the story, and we'll have more questions for you as we go along. I want to ask Kyle Rose, who's helped with, has been a part of some of our work here at DiabetesWise and also moderated the last couple of sessions. But Kyle, can you tell us your diagnosis story, and so that everyone in the audience gets to know you a little bit better?
Yeah, thanks, Corey. So I was diagnosed when I was a teenager, about 16 years old. At the time, I was living in rural America in a small town in Idaho. And I'd seen the doctor on and off for the last few months beforehand with, they thought I had the flu and a number of other things, and it just wasn't quite getting picked up. So it sounds a little similar to the last one that was told there. In my case, I definitely had started to develop all the familiar symptoms, thirst and frequent urination. And actually, finally, it was my eye doctor who said, hey, your vision's changed so drastically, so quickly, you should really go get checked for type 1 diabetes. And sure enough, he was right. That same day, I went to the primary care doc who had been seeing me previously with some of these symptoms, that same office, and they detected sugars in my urine. And I remember one thing that my parents and I at the time were saying, okay, well, sounds like the doctor was saying we need to go to the hospital. I said, okay, we'll go home and we'll get a bag and all that. And he's like, no, you're going to the hospital, like right now. And I remember that just kind of stuck in my head, like, oh, yeah, this sounds like it could be something serious. And one other kind of funny tidbit, if I could, on that story, was the night before I'd been invited to go out to the movies with my brother. And my brother is 8 years older than me, so that was a big deal to get to go hang out with my brother and his friends. The place where we sat in the movie theater was right in the middle of the row. And I was probably drinking one of those big gulp. It was non-diet soda, and I was needing to get up every 10 or 15 minutes. I remember a comment from one of his friends, like, boy, your brother's like a real pain. But sure enough, there were some good reasons for that. And the next 4 or 5 days, my brother was there to support me every day in the hospital. So no harm done there. But just some things I remember. And then the next chapter of my life started after that.
Yeah, thanks for sharing, Kyle. I think that that resonates probably with a lot of people, the people on the panel, but then also, the individuals that are attending, and we'll view this later. There are a lot of overlapping characteristics as people have described here, but there's always some unique part of it in the diagnosis or the days leading up to it or the days after that I think are memorable for people. Kind of sticking with you, Kyle, I wanted to ask you maybe first to tell us how long ago did you first try a diabetes device, and how long was that after you were diagnosed?
So it was during my college days, which was only a few years after my diagnosis. I tried an insulin pump for the first time, and it wasn't the first generation of insulin pumps. I'm not quite that old, but it was one of the earlier generations, let's say. And at the time, it was using kind of a bent needle infusion set that didn't detach and attach as easily as they do today. And it really wasn't a good fit. I tried it out. I was very active in sports already at the time. And since there wasn't kind of an easy way to put it on and off for sports like soccer and otherwise, it wasn't a good fit. So I only tried it for probably a few months and then decided to go back to injection therapy at that time.
And I think that one of the things that hopefully we talk about as we go along is that there are occasions when there's this kind of start and stop to using devices. And so understanding, hopefully everyone attending understands that happens, and also that it doesn't mean that you failed or that it just may not have been the right fit for you at the time. And so I think we'll circle back to some of those comments, Kyle. And I'd be interested to hear from Sharice and Tiana. When did you first try a device, and when, and what was your reason for trying it first?
So I will take the lead on this one, and I was 3 months after being diagnosed, and I remember it was my 18th birthday, actually, I was able to go in and get an insulin pump. My doctors heavily recommended. I was wanting to still go off to college at that point. I had plans to live in a dorm and do regular college things. So they said, you know, if you have an insulin pump, it might make things a little easier for you. And I'm like, all right, like, let's do it. So as soon as I could, I signed up for everything and got my insulin pump in. I had the nifty old handy dandy Medtronic pump, and I loved it. It was amazing for the first 6 months. It did take a little bit of adjusting to. I think sleeping with it was definitely a change for me, learning to like not, you know, get tangled up in the tubing and everything. But that was when I very first tried an insulin pump, and I don't regret it.
Thanks, and Charisse?
So when I was diagnosed, I had the option to go on oral medication or on insulin. So I was actually on oral medication. I took a half a pill of glipizide every day up until the point I got pregnant, which was 9 months after I was diagnosed. And then I went on insulin for a short period of time. And then I went back on oral medication. And then when my daughter turned 2, I decided that, you know, the medication wasn't working, the oral medication wasn't working. So I told my new not endocrinologist, my nurse practitioner, because military family, so diagnosed in Kansas City, moved to California, and I said, hey, look, this medication's not working anymore. I'm on 1,500 milligrams of metformin. It's just not working. It's time for me to go see an endocrinologist. So found a great endocrinologist, saw a nurse practitioner there. And he was like, you have what? I was like, type 1.5, you know, LADA. He was like, but that's more common in older white women. You're Black. And I was like, okay, so here we go again. So once again, they drew more blood and came back and once again diagnosed as LADA. At that point, he was like, you have options. Your pancreas is still making insulin, but your it's not enough. So you can stay on your medication if you want, or you can go on insulin. And I was like, okay, I'll go on insulin. And he laid out every insulin pump on the market, even the Cosmo pump that was going off the market. And he was like, I like to show everybody what's available and then allow you to go home and do your research. So I did my research, and a lot of things that factored into my decision for insulin pump was that my husband was active duty Army. So he was not home a lot. So my 2-year-old daughter at the time was my primary caretaker. So for me, I decided to go on the Omnipod because that was the easiest thing to teach to a 2-year-old kid how to use.
Well, and you know, this made me think of one of the other questions I wanted to ask you about. I think you've each described, you know, and Tiana 3 months into it. Kyle, it was several years later, and when you know, from high school to college, and Charisse kind of described another situation, you know, across several years of, you know, first exposure to using different devices and things like that. But one of the poll questions we have is related to this question I want to ask the panel when we come back, which is about reservations and worries you had when you started it. So maybe we could have that second poll question about worries that sometimes people have when they start on a device. So the question is, have you experienced any of the following? So you can check one or more to this. Nervous to ask your diabetes care provider to start a device, nervous to tell your diabetes care provider that you know, a device isn't working for you, it doesn't fit your lifestyle, worried that the device is going to impact a relationship you have, worried that starting a device is going to be too hard, unsure who has the final say or is kind of the decision maker in whether or not you start a device. And so these are things that we hear from people with diabetes, that there are things that they think about when they're starting a device. So if you can chime in there. And Julia, once you see that it's pretty well finished, then why don't we share the results? And here they come, it looks like. So certainly, you know, the big, I guess, winner slash loser here is the worry that starting a device is going to be too hard. So that's certainly something that, you know, over half of the respondents said is something that they think about. And then everybody else, you know, had some nerves or worries about how this might impact some part of their relationship, or, you know, relationship to diabetes or other relationships. And then certainly, I don't think it's always clear who gets to make the final decision about who starts a device, and I want to talk a little bit more about that as we go along. So thanks for doing that, Julia. So panelists, you know, and I don't know if, you know, Kyle, if you want to jump in first, but, you know, you started when, you know, with the pump when you're in college. What kind of worries or reservations did you have?
I think the biggest one for me was that it would be a constant reminder of my diabetes. I was really in a phase in my life where I was striving for independence in general, let alone from, you know, now living with this chronic disease. And I somehow in my mind just thought it would be a constant reminder on my arm or on my side. I think there was also the fact, so, you know, I was going through that whole question, seeing how many I would actually check on. There are quite a few. I think I also was worried that somehow made my diabetes more serious if I needed to wear, or if I chose to wear a device, and that people may look at me differently, pity me, or even, you know, maybe think that I didn't deserve a spot on the team. Sports, as I mentioned, was really big to me. So they would not somehow see me as equal. All those perceptions turned out not to be the case, I learned later on.
And thanks for sharing that, Kyle. And Charisse, you know, you had talked about that it took a little while for them to decide, or you to decide, that you needed to be on insulin, you know, after pregnancy, and then several years after that. What did you make of devices and starting on them? And, you know, you were kind of probably, you had a 2-year-old at home, so you were probably flooded with a lot of other things. But, you know, what reservations or worries did you have when you were thinking about devices?
I would say my reservation that I had was, like I said earlier, being that my 2-year-old daughter was my primary caretaker, can I teach her how to take it off? Can I teach her how to push the buttons if she needs to, you know, to make it inactive? Can she tell somebody, or even be able to pick up the phone to dial 911 at the age of 2 and say, you know, my mommy's passed out, she needs help. And then another reservation that I had was, so I get diagnosed with diabetes, I went on oral medication. So when you factor in my husband, you know, it's like, okay, I know he loves me for who I am, but I'm gonna have this thing on my body, like during intimacy, like, is he still gonna find me attractive when I don't have my clothes on and I got this pod hanging off of me? I would say those two things were the only reservation, because once my nurse practitioner at the endocrinologist was like, here are your options, or you can take shots for the rest of your life, I was like, sign me up. But those two things primarily was making sure my 2-year-old, and of course my husband.
Yeah, thanks for sharing that. And maybe I'll ask Tiana the same question, but also ask if, I think that you now use CGM, is that right? Yeah. And so maybe kind of, you started a pump just several months after, you know, getting diagnosed, but what was it like when you started the CGM? When was that? And did you have some worries about it and any reservations about it?
I actually started my CGM not long after getting my pump. I believe it was about a month or 2 after. At the time I had the Medtronic CGM, so it was a little different than the current one that I'm using, which is the Dexcom G6. And even when I first got my insulin pump, I think with anything going on your body and just being a younger girl, just really figuring yourself out and heading off to college, and in that phase in my life, and even still now as a young adult, there's a lot of stigmas on how we should portray ourselves and how we should look. And I remember so vividly having like this internal battle of like, I know this doesn't look great. It's not like very appealing. I know there's going to be people that might look at me different. I went 17 years without a pump. So now I'm like wearing these things on my body. And there's even still days now where I wear my insulin pump very proudly, but I'm also very cautious. I'm like, I don't want people to assume that I am incapable of doing things, or that I don't want people to feel bad for me, kind of like Kyle had mentioned. So I do proudly like wear my CGM and my insulin pump, but I think even still today, there's times where it's not hindering me, but it does kind of impact the way I view myself too.
No, thanks. And, it's been, all of you have hit on that, the social side, or the kind of, the perception or image of yourself based on these different devices and technologies, and just having diabetes. And I really appreciate all of you sharing that. I think it's good for others to hear that everybody thinks about that this isn't unique to them, and it's a good thing to share. Jumping off of that, I wondered if, based on your current use of devices or not using devices, from your perspective, and maybe Sharice, if you want to jump in first, based on what you use or don't use now, what are the best things about having these devices and having access to them?
So I would say for me, if I take how I used my device when I first started it back in 2008, 2009, and how I use and view them now are totally different. I think that for one, I loop. So looping has made me more engaged with my care, and actually, what's working and what's not working. So I would say that for me, looping has totally changed the game, not only just on how I manage my diabetes, but devices of what I would want in a device moving forward when I make that decision. So I think for me, I think I've grown up a lot in diabetes. I've had it for 16 years. So the use is different. As you know, us women with our cycles and our hormones, and the older we get, comes more insulin resistance. So I'm about to get ready for menopause eventually. So I want to make sure that I plan ahead, especially since, in the United States, we are locked into a 4-year agreement, whatever pump we decide to go with.
Yeah.
Thanks for sharing that. And I think one of the things that you mentioned there was loop, and just so the audience knows, tell us a little bit more about loop, and what are the parts of it, and what are the things you have to do?
Okay, so I use the Omnipod, and I loop with the Omnipod. I would show you where my pod is, and it's of course not FDA approved, but it's on my buttocks. And I have my little looping device here, and then I have my cell phone. And what it does is the pod talks to the loop, and the loop system allows me to control. I wouldn't even say allows me to control, because I really don't have to do too much. I just make sure the settings and everything is set properly and adjust them as needed. But loops just allows me to live my life without worrying about diabetes. I just go in when needed, push some buttons, and move it along. So that's the thing that loop is. It's fantastic.
Great. Thanks for sharing. Tiana, I didn't exactly ask you this, but tell us, since you told us about your journey and using pump and CGM and about the same time, but on a kind of day-to-day basis, what are the best things about using the devices that you use? What do you get out of it?
Yeah, that's a great question. All I've known since getting diabetes is technology, since I was kind of fortunate to be able to get my pump 3 months after being diagnosed. And so I remember being on MDI and having to constantly make sure my insulin was cold and make sure I had my needles right next to me and that I was ready to take a shot. And you have to wait a certain time period before you can eat again, because you can't take another shot within, I think, 2 or 3 hours. And so from then to now, and just having my insulin pump and my CGM, it's a world of difference for me. I know everybody's different, but I have personally just enjoyed the freedom of being able to go and do things and just have my insulin pump right here. So I'm not running around like looking for my needles or for my insulin. And I think that's really the biggest thing for me, is just having it right there. My CGM has been a lifesaver for me. I am able to check my blood sugar at any time of the day and know where I'm at, versus when I don't have one on, it's like, I don't know if I'm dropping, I don't know if I'm going high. Like, it's just a bunch of questions, internal thoughts that you're just kind of wondering about your blood sugar. So yeah, I love it so far. It's been great.
Yeah, that's great. And for those of you, just a little bit of a shout out to one of the sessions that Kyle moderated a couple of weeks ago. That's on our on the DiabetesWise.org page, is a session on CGM, and we spoke with Naya, a person with diabetes, but then also Carrie Leone from Dexcom. And there are some really important points there that I think you also echoed about the benefits of it. But and so if there are individuals out there that are thinking about starting or want more information, that's a really good resource as well for that. Kyle, I want to hear your perspective on, the best parts of devices, but also what are some of the drawbacks that I know that you've changed from using devices sometimes to not. So tell us a little bit about the best parts, but also what's made you make some changes at times.
Yeah, I think that's a good mini summary. I mean, so maybe I'll start by saying I'm also looping, so I'm on what's sometimes called a DIY or open source system that Charisse just explained, and I'm also using the commercially available Omnipod and Dexcom systems, but together in that bundle, which works great for me most of the time. And I think those of you in the community who may know my work, I've been involved with device companies in the past as an engineer in various roles. And so I kind of have two sides to my life where I get really engaged and a bit of a diabetes geek, if you will. And then I've got the side at home where maybe some people would still call me that, but I don't see myself like that anymore. And in fact, I see myself, particularly in the last few years, wanting to just focus on other things. So any device or therapy for my diabetes that allows me to do that is huge for me. And I think we heard freedom from Tiana. That really resonated with me, the freedom to just kind of go on and live my life. One of the issues with insulin infusion for me in general is I have developed lipodystrophy in certain parts of my body, which limits where I can put infusion sets. I just in general have a very poor absorption in those areas. So of course, a system can't function as it's intended to, or it has difficulty doing so if it's not infusing the insulin and being absorbed. I think that that's often a topic that we don't pay enough attention to, the infusion sets and absorption. And I know that there are companies working on it, so I'm excited to hear that. But because of that, I've decided to also go back and forth between injections as needed and work with my healthcare professional to find out a system that works for me.
Yeah, no, that's thanks for sharing that, Kyle. And I wanted to see if Tiana or Charisse had any kind of additional thoughts to that, based on what Kyle said, but also just thinking, have there been times when you've thought, I think I'm done with devices, I need a break, I don't want to do this anymore?
Device burnout is so real. I think sometimes I'm just like, I really don't have the energy to get up and walk downstairs and change everything. And like, there's a lot that goes into it. It's kind of time consuming sometimes, and you just don't want to do it. I can't count how many times I've cried because I'm like, but at the end of the day, I know I'm very fortunate to have devices. And yeah, device burnout happens, I think, to everyone, caregivers and people living with type 1. I don't know if Charisse has any input on that side of things.
So for me, I know this is going to sound weird. I don't take a pump break because I'm burnt out. I take a pump break just so I can retune or refine my diabetes skills, because I think sometimes we become so dependent on devices that when one of them breaks or something starts happening, you call the insulin pump company, like, oh my gosh. And then they're like, we got to overnight it to you. You're like, I got to wait 24 hours. So for me, I take a break once a year for a couple of months to kind of reset and make sure that I understand and know what my Lantus units would be, and make sure I know what my Apidra units would be, and make sure I have some Afrezza on board to help cover me when I take those breaks.
Yeah, that's a good point. I remember having the same experience with my Dexcom, where at times I'll check my blood sugar and it's like a little off, and then I'm like, I don't know which one to rely on. But I do think there's times too, and I'm like, I can't even feel my lows anymore, because if my Dexcom's not telling me I'm low, then I'm not low. So yeah, taking breaks like that is definitely important too. I agree with you.
And I want to go to, I think our last poll question, or no, I'm sorry. I think I'm going to first go to Sierra, because I think she has a question from the audience that I think would be good based on our discussion that we're having, and in each of the panelists' perspectives on this. I'd love to hear. So Sierra.
Sure. So this question comes from an audience member who asks, what suggestion would you give someone who is on the fence about starting a device? And that's to any of the panelists. Yeah.
Yeah. Any advice that you would give for, someone who's on the fence about starting a device?
I would say to do your research. Make sure that you do thorough research, because like Sharice mentioned, once you get this device, you're locked in for 4 years. So if you're looking at one insulin pump, but you also are on the fence about maybe another one, sleep on it for a couple days and make sure that it's for sure the one you think is best for you. It's great to reach out to people and see what they like, but one of my biggest recommendations is do what works for you. So what works for Tiana might not work for Amber or Ashley. Like, you have to do whatever caters your needs the best.
And I was going to kind of say the same thing. Research, because you're married to that device, whether you like it or not, for 4 years. Also, I think that something to say as well is when you come to the point where you want to change devices, right? It's make sure once again, you do your research, outweigh the pros and cons, because what may work for you today may not work for you tomorrow. And make sure you're comfortable with taking pump breaks and working with your healthcare professional to make that happen. Because like you said, insulin pump fatigue, CGM fatigue, it's real. And it's common knowledge that people should have on hand anyway. So research.
Kyle, do you have any thoughts to add on that for that person who's kind of sitting on the fence?
No, I think my co-panelists said it well. As I mentioned earlier, I definitely had these concerns. They're real, and I think a lot of us have them, but pretty much all of them turned out to not be the case for me. And so I was reassured once I was on the device and living my life.
And the couple things that I would add would be, obviously we're a little bit biased here, but check out DiabetesWise.org in terms of, you can do some functions you can do some parts where you're kind of comparing a type of CGM versus another. You can think of some of the features of the pump. So you can figure out a little bit of that research that I think everybody is advocating. And then the other thing I maybe a little bit to Kyle's point, I would also suggest that it doesn't have to be a 100% full start, especially if it's something like CGM. Try it for a week or the period of time that it works. Take a little break from it, evaluate it, see how it goes. You don't have to go on and be full tilt 24/7 all the time. Most people end up doing that because they notice a lot of benefit, but there are ways to start slowly and warm up to it versus a complete, jump right into it. I wanted to ask all of the panelists, and I know maybe I'll ask Tiana first if she wants to respond. Um, in terms of diabetes management and diabetes supplies and diabetes device supplies, has there been anything different in the COVID era for you? Has there been anything that's been harder? Tell us a little bit about any things that have changed for you in the COVID era.
Yeah, since COVID started, which was really like back in March, I live in Colorado, so that's when things started getting a little more serious here. I remember calling Dexcom and Tandem and just trying to like order extra supplies. No one really knew what was going to happen, so I just kind of loaded up on supplies, which I probably should not have done now, like in hindsight. But I think as far as supplies and access to that, I haven't had any changes or issues since prior to COVID. So everything for me has been the same.
Charisse or Kyle, what about you? Have you had any changes in the COVID era around your device supplies, diabetes supplies, things like that?
I have not had any changes. Luckily, I am the community manager for Diatribe, so we get a lot of information, and so I wasn't concerned about it. And also, if it was to a point where I did become or get into a bind, as far as when it comes to CGM, my husband has type 2 diabetes and he uses Dexcom as well, so he would have my back with that. But no concerns whatsoever as far as the supply for insulin pumps.
Yeah, I would echo that in my experience with the different supplies I've been ordering there, I've been reassured by the device companies. In fact, we had a session on DiabetesWise that covered some of that topic as well, that I hope was reassuring for people, because it is something that definitely ran through my mind. What Tiana was, her reaction there, pick up the phone and boy, I better order up and get as much as I can. I mean, I think that's only natural. For me, more it's been just aside from supplies, and we'll perhaps get into this later, Corey, it's just been the additional stress of the pandemic and everything that's brought with it.
Mm-hmm.
You're absolutely right. I think that it's even if there aren't supply issues or device issues or access to your doctor issues, that everybody is feeling stressed now. And I think that particularly people with diabetes, I would add that I think there's been some mixed messages about people with diabetes risk for COVID, and if they do get COVID, what are the likelihood of developing some severe problems. And so I think that everybody tries to err on the side of being very, very cautious at this time from a diabetes perspective. And so, having extra supplies on hand, being a little bit more cautious about interactions, I think all make a lot of sense. And it is a consistent theme that we've heard from people with diabetes to try and do that. This also brings me, what I think we'll do as our last poll question. It brings me to the question that I want to hear the panelists talk about too, is, that each individual with diabetes, their experience is likely going to differ from another person's with diabetes. And there are a number of other, factors that play into that. And so, this poll question is really about who should have access, and then I want to follow up with some questions with the group. So the question is, do you think more people with diabetes should be wearing devices like CGM and insulin delivery systems? And it's a pretty straightforward response: yes, no, or not sure. So do you think more people should be wearing devices? So Julia, what do you think? We can probably do the results now. And so, we may have had a few plants in the audience, but certainly people are, thinking that more people should do that, should have access to it. So I want to ask the panelists, and maybe I'll ask, Charisse to comment first, but thinking about access to devices, from your perspective, person with diabetes, person of color, woman of color, tell us about what your perception is of access to the diabetes devices. And you only have about a minute, so no, I'm just kidding. But tell us about, no, but tell us your perspective on this.
Okay, so my personal perspective on this, I'm going to come at it two different ways since I have a minute. First, I think anyone that uses insulin should have access to an insulin pump therapy, no matter what type of diabetes they have. I think that the rules set in place that people with type 2 need to have a qualifying C-peptide, especially Medicare's rules, are a little outrageous. So that's one thing. Secondly, I think that more people of color need to have access to the technology. I don't want to say that cost is a barrier, because we pay for what we want and what we need. I think if there was more education out there for people of color with diabetes, I think more people would actually probably be on it. I shouldn't have to walk into a room and the kids like, oh my gosh, what's this? And their parents like, oh my gosh, what's this? So I think that more education and more access for people of color, especially in lower income areas, I believe they should have access to it, and not believe they should.
Yeah.
Thanks, Charisse. And Tiana, do you have thoughts on it as well?
I think Charisse hit a lot of those points right on the head. Education is a huge one. And I think that's something that we lack in a lot of our communities, is just access to education, finding ways to provide beneficial information to people who may be misinformed, or maybe people don't even know about these devices. There's so many different different factors that play into it. Additionally, in an ideal world, I would love for everyone to have access to supplies, to CGMs, to insulin pumps. But at the same time, I also understand that it is preference, and some people may just not want to have an insulin pump. This is a conversation that I had pretty recently, and I think in the Black community, there's stigmas on people who have devices or conditions like diabetes. It's not like it's talked about often, and sometimes when you already look different than a lot of people that you're around, you don't want an additional object or labeling that makes you even more different or separates you even more from the majority. And that's kind of been a personal battle that I've dealt with, is just making sure that I show up completely Tiana and not Tiana, just Tiana the diabetic or Tiana the Black woman with diabetes. I want to be like my full self and comfortable in my devices as well.
Yeah. Well, I appreciate both Tiana and Charisse sharing their perspectives. And then, and I think another perspective that I think is valuable, Kyle, from, you've been part of the International Diabetes Federation and have thought about globally some of the issues around diabetes treatment, and not always specific to devices, but what are some ways that you see that can improve access to diabetes devices and technologies that really do show improvement in outcomes?
Well, I mean, I would defer to my colleagues, certainly on the co-panelists on the previous question. But at IDF, to your point, we do work across an international spectrum, and I think that there's a lot of work that still needs to be done, and the COVID-19 pandemic, I think, has exacerbated this and put it in the spotlight where the healthcare system is hurting, and in geographies where it's maxed out, it's been a real challenge, particularly for those populations of people that are exposed because they have to be, because of the infrastructure and how their work is set up, perhaps in a factory or transportation. And for all these reasons, I think we've seen that there's been a real inequity across populations, right here in America as well. I can't comment on that personally. I've been extremely fortunate in my life to have access to these devices that have really helped me with my diabetes management. And I think that we can always continue to work and need to work to try to provide that more equally across the board. I was delighted to see that the device manufacturer companies have programs in place to try to help people. And we discussed that in some of the previous DiabetesWise sessions. Do I think that they could do more? Sure, I'm sure they could, but I think it's a great first step. And that would be my primary comment is look into these programs to see if you might be eligible for help financially to have access to these systems.
Thanks, Kyle, and thanks all the panelists for the work that they do from an advocacy standpoint of pushing for more inclusion, better access, and we certainly want to amplify those, that as well. We think that we want to do more to make sure that we broaden access and address issues that make it harder for certain individuals or certain groups, certain cultures to get access. We want to do better with that. I wanted to maybe go to Sierra there's a little bit of a couple questions in the chat, and I think Sharice has she's answered a couple of questions, but maybe Sierra, do you want to ask that so that everybody kind of hears that, and we can give Sharice a chance to answer too?
Sure, yeah, this is a great question. So with the COVID environment that we're in right now, is there any truth behind, some of the stories we're hearing with CGMs not being allowed in hospitals? And has that changed, and kind of what's going on there?
So it's actually funny that this question came up because I just had surgery on the 22nd. And so I knew that I was going to have the surgery. So beforehand, I sent an email, actually during my virtual appointment with my endo. I was like, hey doc, I'm having this surgery. And I said, do you see any objections to me keeping my system, my looping and my CGM on? He was like, oh no, for that, you should be fine. Just make sure you keep decrease your basal settings, da, 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 da. So my OB, she knows I have diabetes as well. And she was like, you know what? I don't see a problem why you can't have it on. So the day of surgery, she was like, just make sure you bring extras just in case something changes. So day of surgery, I went in and she came in. She was like, you still got your insulin pump on? I was like, yes. But I was smart because I placed my Omnipod, my pod, and my CGM on the exact same arm. And I knew that the anesthesiologist would probably be on the left side, just based off of my C-section and everything. So she was like, okay, good. So the anesthesiologist came in. I was like, I just want to make sure that you're comfortable with it. She said, yes, leave it on. We'll be fine. The OB talked to me about it. It's good to go. So I didn't have any problems keeping the loop system along with the CGM on. And what's actually crazy and funny to me is that a lot of the hospital staff, which is not surprising because they don't specialize in it, they've never seen a CGM before. So they were like, I need to check your blood sugar. I was like, oh, okay, but it's this. They was like, how did you already know that? And I was like, because I have my CGM. So I think they were really fascinated by it. So every time they would come in, they would say, so what's your blood sugar? Because they didn't have to check it because I had my CGM.
Oh, that's great. And I think one of the things I'll add to that is that you're talking about an experience with the Dexcom system, but we also, when we asked Abbott about some of their programs that they have, they also highlighted some of the approvals that they received through the FDA about using the Libre in the hospital. So I think that, and I believe that that's listed on our website as well, but I think that there are options to do it. And, and I think many of us feel the same way, that, you want to have as much control in the hospital of your own diabetes, and that these kind of tools make that a possibility. So we're approaching the end of the hour, and although I think we could talk for another couple of hours. I want to be respectful of everybody's time. And so maybe I'll ask if there are anything from the panelists, anything else that they want to add. You can talk about, benefits that you've received from it, other kind of annoyance or nuisances around devices, anything around access. I just appreciate any kind of additional thoughts that you want to provide. And maybe Tiana, if you want to jump in and go first, but anybody can jump in here.
Yeah, I would add that like I said before, my Dexcom and my t:slim have truly changed my diabetes management. I'm able to share my numbers with my parents. People don't have to worry about me as much, and I don't have to worry about me as much. So personally, I've just enjoyed using this technology. I would recommend it to anybody who's open to it to at least consider or give it a try. And if you don't like it, then that's okay. At least you gave it a shot. But I'm always open to questions if anybody has any as well about my devices. And yeah, thank you for having us here. I really had a fun time. It's great.
Thanks. And can we, if maybe either you, Tiana, or Sierra can put into the chat your handles on Instagram and others, so that we can make sure that everybody has access to that, and that because we certainly have appreciated hearing your perspective, and glad that you're a part of that. And I'll ask Kyle, maybe if you have any, and Sharice, if you want to add any kind of additional thoughts.
Sure, I can go next. I would echo the thank you for being having the opportunity to tell my diabetes story alongside these other folks and sharing the stage. I appreciate that. There's 2 points, I guess, maybe kind of wrapping up. I wanted to quickly mention that since we just spoke about it, just regarding perspectives of people with diabetes during COVID-19, Renza at Diabetogenic and I wrote an article about this that's in Diabetes Research and Clinical Practice, kind of an international viewpoint, and I'd be happy to share that link if appropriate after the fact with the audience. I think she tells a very compelling story about some of these things that we've discussed. The numbers are scary out there, the association with diabetes, and it's just kind of can be a frightening time if we're digesting that media every day, and that's what we talk about a little bit in the article with some guidance. And then maybe just a last point, because I feel like I answered the questions in a rather critical way so far today, but I wanted to make sure that I got the message across that these technologies for me have completely changed my life. I mean, what Tiana said, for me, if I could pinpoint it, when I went to hybrid closed loop technology, my overnight control was nearly perfect, or at least I would wake up at 100 milligrams per deciliter 7 days in a row. That just didn't happen before that. And whether it was trying out some of the commercially available systems, I was even in trials on some of the commercial systems before they were available, so I've been very fortunate to have access to that, or Loop, thanks to the DIY community and the Night Scout Foundation, all those people who've done amazing work to make that available. I've benefited immensely, and it's allowed me to live with a great deal more freedom with my diabetes.
Yeah, that's awesome, Kyle. Thanks for sharing that. And I just posted the link to that article that you mentioned in the chat. So for anybody listening and wants to look at that, but it's a really nice article. And then Sharice, closing thoughts? Love to hear anything additional.
Just to add to what Tiana and Kyle said, Loop changed my life. And it's funny because now, since I had the surgery, my out-of-pocket's met, so I can get a new system. So I'm actually in the process of thinking about switching to Tandem, because I've seen so many people switch from Loop to Tandem and had pretty much similar success. I also would like to say that although we are talking about, technology, there's this term called your diabetes may vary. And I think when it comes to devices and people wanting them, I don't think people should be forced to have them. I think it should be up to that individual choice of that person with the type of insulin pump they have, should be based on the person's decision and not the doctor's decision. I think that should be a partnership. And just because one technology may work better for the doctor because they're used to it, be open to what the person with diabetes wants.
I think that's a perfect way to end, to be responsive to what the person with diabetes wants. And so I want to thank all of the panelists today. It was great. I really appreciate hearing your stories. And I also want to thank Julia and Sierra for all their work at DiabetesWise and making sure that this happens and goes smoothly. Again, you likely saw a link in there to provide a little bit of feedback on the session. You can also go to our diabeteswise.org COVID link, and you can see more information, and you can see those past presentations. And this one will be up and live within a couple of days. So again, thank you everyone, and take care and stay safe.
Thank you.
Bye.